From city workers to supermarket staff and school teachers. For most of us, soldiering on when we're sick is standard practice. But at some point in the next 2 weeks, the government will advise that anyone who feels even mildly ill should take a week off work.
Is that realistic for you?
Of course not. Of course not. Who's going to pay wages?
People on 0 hours contracts, unless the government makes provision for them to pay them, I don't think they can do it.
We'd be able to work from home anyway. I guess not that many people can necessarily say the same.
So you think your employer would be sympathetic?
I hope so. I hope everyone is reasonable to protect their own and their loved ones as well.
The reason? The models of this virus's spread predict that in 10 to 14 days, the number of infections will begin to rise sharply, the start of our 3-month-long epidemic peak. And everyone staying at home if they're poorly will protect the most vulnerable.
When we know there are a large number of cases circulating, we can, without testing, we will be able to presume in most cases that that is the disease which they have. We can give them very specific advice about how to self-isolate at home, and then they are effectively containing their own disease, and that's helpful for other members of the public and in managing this epidemic peak.
We've got some plastic disposable aprons.
But if there's one profession that really can't afford to go off sick for a week, it's GPs. At his Doncaster surgery, Dean Eggitt is frustrated the official guidance he must follow hasn't been updated to reflect the fact the virus is now circulating here.
In theory, anybody who has a respiratory illness could be at risk of having COVID-19. That puts us as frontline clinicians at risk every day with every cough and cold and temperature that we see.
The whole profession is concerned, today calling on the health service for swifter support.
It is tough on the NHS to get this right. They have tended to prioritise what's going on in the hospital sector and what's going on in 111, and I think it's time now for them to turn their attention to general practice, because I think we can be pretty sure in the next week or 2 weeks it's going to hit general practice quite hard.
And Dean knows his work over the coming weeks will be vital.
If primary care goes down, which is the bedrock of the entire NHS, the rest of the system will be overwhelmed. We need to make sure that primary care colleagues are safe and protected to ensure the rest of the NHS system as a whole is safe and protected.
Doctors must stay well to do their work. And to help that happen, the advice for the rest of us will soon be to avoid spreading any illness we pick up.
Well, in a moment, we'll be speaking to our political editor, Andy Bell, who's in Downing Street. But first to our health correspondent, Catherine Jones. And Catherine, many people will be wondering, when we see what's happening in Italy, could that happen here?
Well, let me quote the Deputy Chief Medical Officer directly by way of reply. She said today, we would be looking to avoid what's happened in Italy. And Jenny Harries said that's because the mathematical models that the UK is using have indicated 2 other strategies used together will work better than complete lockdown. Those 2 measures are some specific strategies to look after and protect our elderly population, plus this go home and don't soldier on advice for all the rest of us. Not yet implemented, by the way, but potentially coming in the next 2 weeks.
You also speak to doctors and other hospital staff all the time. I mean, what's your sense of how they're viewing what's to come, if you like?
I think deep concern generally. When it comes to hospitals, for example, and intensive care capacity, the number of beds in intensive care and the number of people who may need them just simply doesn't match up in some scenarios that this epidemic could run through. On the positive side, I think everyone has faith in the experts, those scientists who are running things from the top. What they question, though, is how quickly and practically that is translating to them on the front line. So, for example, the first case of UK transmission in this country was 10 days ago. Those protective visors, more supplies of them are literally only arriving in GP surgeries from yesterday. And even tonight, GPs must still technically rule out coronavirus as a diagnosis unless there's a link to Italy or South Korea or China or something. I mean, that simply hasn't kept up with the situation, and it's leaving GPs confused and feeling scared that they're at risk.
OK, for now, Catherine Jones, thank you. Well, to you, Andy, the new Chancellor unveiling his first budget tomorrow. I mean, can we expect the coronavirus to feature heavily in that?
There's no doubt that this first budget after an emphatic election victory is having to be reworked because of coronavirus. Rishi Sunak, the Chancellor, barely in the job a month, is basically having to worry about things that weren't even on people's radar a few weeks ago. So for a start, for instance, the Prime Minister's already said that whatever money the NHS needs, it will get. So he may have to find some extra spending there. Then what about workers on low pay who perhaps don't qualify for sickness pay, who have to stay home to self-isolate? He's probably going to have to find some money to ensure that they're not out of pocket. And what about businesses? He's going to have to help businesses get through what promises to be an extremely difficult period. Perhaps he may offer to defer, to put off the moment when some businesses have to pay some sort of taxation. So we wait to see what sort of measures will be in the budget tomorrow. But if it does cost some extra money, I think we can expect that this government is going to be prepared to borrow more to pay for that.
OK, Andy, thank you. Well, you've ever wondered how emergency COBRA committees actually work or how the government responds to crises such as the coronavirus? Now is your time to find out. In Andy's podcast, How Did We Get Here? Andy's speaking to a former chief strategist at Number 10. You can find it everywhere you normally get your podcasts.